Thank you for choosing to learn more about addressing responsive behaviors in people with dementia in the hospital setting. This is Module 3 of the 5-part learning series. In this module, we will explore care planning, including identifying priority behaviors and setting goals for them, planning interventions, safety measures, non-pharmacological interventions, pharmacological interventions, and monitoring and revising the care plan. Care planning for responsive behaviors can be complex. Effective care planning requires identification of priority behaviors. If there is more than one responsive behavior of concern, review the chart documentation and assessment data to consider which behaviors to focus on. When identifying priority behaviors, consider the following. Is there a safety issue for the person, family, and/or others? How often does the behavior happen? What is the effect of the behavior on the person and others? How important is this for the person? Have possible triggers/unmet needs been identified? If possible, try to work on one priority behavior at a time. Managing responsive behaviors often requires trying different care approaches and evaluating the person's response. It may not be possible to eliminate a behavior completely, so setting realistic goals for improvement is important. Set behavioral goals that are achievable for the person and the care team, and have established time parameters to review progress. Document progress towards the goal through chart documentation or using a behavioral tracking tool to ensure an accessible method of evaluation or review. An example of a goal for a priority behavior would be, during this admission, the person will feel more comfortable and cooperative during morning hygiene care. An example of parameters to evaluate this goal would be, review the behavior tracking tool for frequency of hitting out during care in 1 week on January 1st. Remember, when responsive behaviors occur, use a systematic approach to assessment and management. Step 1 is to assess the risk of harm to self or others. Ask, is the person's safety at risk? Is the safety of others at risk? Consider if the situation is low risk or high risk. Be prepared with a safety plan for behaviors that pose a risk of harm to the person or others. In low-risk situations, investigate possible causes and implement non-pharmacological interventions to address those causes. For example, for a person who is trying to enter other patients' rooms, changes in the environment or redirection might be appropriate. High-risk situations require immediate measures such as calling for assistance from team members, securing the environment, implementing code-wide procedures, using de-escalation strategies if possible, and seeking medical support as required. After addressing safety concerns and identifying contributors and the potential meaning of the behavior, an appropriate care plan of intervention can be implemented. Non-pharmacological interventions are the first-line approach for managing responsive behaviors, as they are more effective in reducing symptoms like agitation and aggression while posing minimal risks compared to pharmacological treatments. Non-pharmacological interventions include activity-based interventions, which involves tailoring activities to each person's preferences and personality, promoting autonomy and well-being. Communication, which considers appropriate communication techniques to connect with the person in a positive and calming manner. And environmental, which looks at adjusting the physical and social surroundings to reduce stress triggers. When these elements are combined, they lead to more consistent and lasting improvements in symptom management, making non-pharmacological approaches a safer and effective alternative to medication. Activity-based interventions are psychosocial in nature and require tailoring to individual preference and capability. Their application will depend in part on the capacity and availability of resources. These interventions include, but are not limited to, social engagement, which involves discussion about family or friends, pets, or favorite hobbies or interests. Cognitive stimulation are activities that stimulate the mind and reduce boredom. It can include providing items like blocks, dolls, activity aprons, or stress balls, or games like puzzles, cards, board games, crosswords, word search, mobile/tablet games, coloring, or reading materials, or videos. Physical exercise can include things like encouraging walking, range of motion exercises, resistance exercises, balance exercises, stretching, and others. Music experiences may include listening to favorite songs or relaxing atmospheric music. Reminiscence involves activities that provide reminders of a person's past or family members, for example, photo albums and scrapbooks. Animal therapy can include live animals or robotic or stuffed animal companions or visits, and massage or therapeutic touch as appropriate. Communication-based interventions such as validation, redirection, and reassurance can help to reduce distress, acknowledge the person's emotions, and gently guide them toward a calmer or more positive state. Validation places emphasis on the emotional aspect of communication rather than the factual content. Validation involves listening to the person and validating their feelings. For example, "I understand why you are so upset," or "that must be frustrating." Supporting the person's reality, even though this may not correspond with our current reality. And responding with compassion to the emotional message. Redirection involves validating the person's concern by saying, for example, "You think someone has taken your money? I can see why you'd be upset." Joining in their reality. "Let's look for your money together." Leading them to a distraction. "Let's try looking by the lounge for your money," and redirecting their attention. "It looks like they're having a cup of coffee. It smells good. Should we join them?" Reassurance is another useful communication-based intervention, especially for individuals experiencing anxiety, confusion, or distress. The goal is to help the person feel safe and understood, which includes speaking slowly and clearly, clarifying what the person is telling you, and validating their emotional response by saying, for example, "I'm here to help you. We'll get through this." Environmental interventions include both the physical and social aspects of the care setting. The physical environment involves adaptations like adjusting lighting, noise, temperature, and signage. For example, ensuring doors and drawers have helpful signage. The social environment focuses on building supportive and positive interpersonal relationships between the care team and the person. For example, minimizing the number of people in the person's room. Having those who enter the room introduce themselves, why they are there, and seek permission for what they wish to do. And adhering to the person's typical daily routines whenever possible. A well-designed, caring environment addresses both physical and social needs, creating a space that is both comfortable and supportive for the person. An effective approach to managing responsive behaviors will rely on employing multiple non-pharmacological interventions that are carefully tailored to each person's unique needs, preferences, capabilities, and personality. The All About Me tool can guide the selection of interventions for the person. For people with dementia, pharmacological interventions should only be considered for behaviors when there is risk of harm to the person or others, or there is a high degree of distress to the person. For example, someone experiencing hallucinations and/or delusions may have a risk of harm to themselves or others, or may feel a high degree of distress. In addition, it is important to note that not all behaviors will respond to medication. Some of these behaviors include hoarding or hiding objects, rummaging, repetitive vocalizations, swearing, spitting, and inappropriate voiding and defecation. Use a structured approach to monitoring and evaluating the care plan. Monitor the response by tracking behaviors through documentation of their frequency, intensity, and triggers. Use a behavioral tracking tool if possible. This provides objective data on the frequency, intensity, and patterns of the behaviors over time. Assessing progress towards the established goals. Compare the current observations with the intended outcomes to determine if the interventions are working as planned. Gathering feedback from the care team and care partners. Their first-hand experiences and insights can provide valuable context to the behavioral data. Modify the care plan as needed. Adjust strategies, introduce new interventions, or refine current approaches based on the data and feedback collected. Ensure that changes to the plan are communicated to all team members and care partners, ensuring everyone understands their roles in the updated plan. Set the next review date to maintain a cycle of continuous monitoring and improvement, ensuring the care plan evolves alongside the person's needs. In this module, we learned about identifying a priority behavior and setting an achievable goal with a timeline for review, with an understanding that it may not be possible to eliminate a behavior completely. Being prepared with a safety plan for behaviors that pose a risk of harm to the person or others. Trialing non-pharmacological interventions, activity, communication, or environmental, to help achieve goals. Reserving pharmacological interventions for imminent risk of harm to the person or others, or if the person is in severe distress. Tracking progress towards the goal by using a behavioral tracking tool if possible, and gather feedback from the care team and care partner. And modifying the care plan as needed based on outcomes.